This is one of the most underdiagnosed conditions in people who have got stomach problems, stomach pain, or diarrhea. I'm Dr. A GP based in the UK, and this condition is called bile acid malabsorption. So in people who've got chronic diarrhea, this is a common cause. Now, there are three main reasons people can get bile acid malabsorption. Number one is terminal ileum problems. This is the last part of the small bowel. This can be down to Crohn's disease, or sometimes people have an operation to remove this part of the small bowel. Number two is probably the most common, and when it's idiopathic or when we don't know why you have it. And the third reason is when it's down to another GI condition. This can include things like having your gallbladder previously removed, pancreatitis, small bowel bacterial overgrowth, or celiac disease. So bile salts are made in the liver, and their main role is to help you absorb nutrients from your small bowel, especially fats. So when you eat a meal, your liver and your gallbladder, if you still have one, release bile salts, and this helps absorb all the fats and nutrients as the food moves along the small intestine. Now normally when the bile salts get to the end of the small intestine, they get reabsorbed. When this doesn't happen and you have reabsorption problems, the bile salts build up in your colon, and this causes a lot of water to be reabsorbed. This can cause some quite severe symptoms, most commonly diarrhea, needing to open your bowels all of a sudden, tummy pains and nausea. If left untreated, it can cause gallstones, kidney stones, and low vitamin B12. The best way to diagnose this is with a CCAT scan. This is the gold standard to diagnose malabsorption problems. So treatment is very effective and includes being prescribed some medications which cause the bile salts to clump together so they can be excreted so it doesn't build up in the large bowel. Therefore, water is not reabsorbed and you get less symptoms. Despite this being around for 50 years, I think it's very underdiagnosed and people have IBS and are just left to it and not investigated further. However, if you've got ongoing symptoms, especially diarrhea, this is something that must be ruled out because treatment is very effective and it can really improve your quality of life.